the air we breathe, the amount of stress in our lives and how we handle it, how much sleep we get and when we get it, our attitude, whether it's positive or negative, all these things either strengthen or weaken our immune system. We can't develop cancer unless our immune system is weakened. Chemotherapy and radiation both not only destroy the immune system, but they both cause cancer. Now let's discuss chemotherapy specifically. Chemotherapy has severe side effects, including death. You can die from the chemotherapy, not necessarily from the cancer. I'm giving you information that frequently is glossed over by the doctors who prescribe these therapies. I know I will be severely criticized by my own medical colleagues for telling you the things you're about to hear. They'll accuse me of frightening patients out of the very treatment they need. That's what they'll say. But I think you have a right to know what's being done to you and the effect, both short-term and long-term, it will have on your body and mind. Often the doctors won't tell you the severity of the side effects because they know that if you're fully informed, you'll probably refuse the treatment. So they justify their withholding of the information by rationalizing that you really need the treatment, so it's okay to mislead you. As an example, this is what they're also doing with vaccination information. The medical establishment for years had a little information sheet that was given to the parents of children before each immunization shot. It discussed the potential dangers of vaccinations. It's called an informed consent. But they found that when the parents read the information, they refused vaccinations for their children. So committees got together and they pondered what to do about the problem, and they came up with their solution. They decided to water down the information and withhold from parents many of the horrendous side effects so they would agree to have their children vaccinated. And that's what's been done. There are few groups who surpass the organized medical establishment for deceit, fraud, and propaganda. Again, I'm not necessarily talking about your individual physician, but the organizations, the AMA, the FDA, the National Cancer Institute, and the American Cancer Society. Now, these are the common, immediate, generalized toxicities or the side effects of chemotherapy. Suppression of the bone marrow where your blood cells are produced. This results in decreased white blood cells, the disease-fighting cells you need to fight infection, decreased platelets, the blood clotting cells, so you can have severe episodes of bleeding, and anemia, a low red blood cell count. The second is severe nausea and vomiting. Third is mucous membrane ulceration. There you get painful sores in your mouth, in your esophagus, and even in the intestines, so eating becomes very painful. And what's called alopecia, or baldness. Your hair falls out. These effects and many others that are not so obvious occur because the chemotherapy is poisoning your normal cells. In this medical textbook, there are 50 pages on the toxic effects of chemotherapy. Additional complications include infections involving the teeth and their supporting structures, hemorrhage, that's bleeding, and cardiac toxicity. You have EKG changes, drug-induced cardiomyopathy, which causes congestive heart failure, such as shortness of breath, enlarged liver, ankle swelling, enlarged heart, and fluid in the lungs. And this can occur up to 7 years after your treatment. Plus, tachycardia, which is a rapid heart rate, and arrhythmias. Those are irregular heart rates. Then there's lung toxicity. Chemotherapy-induced injury to the lungs can be fatal and may occur after the drug has even been discontinued. It can cause chronic pneumonia and fibrosis, which is scarring, and fluid in the lungs. And it causes kidney damage that can progress to end-stage disease requiring chronic dialysis therapy. And then there's infection. Chemotherapy causes patients' immune systems to be further compromised. Then they're subject to a host of serious life-threatening bacteria and fungal infections that cause shortness of breath, chest pain, coughing up blood, fever, chills, headache, and hemorrhage. And then there's candidiasis and cryptococcus, which are other fungal infections. They cause cough, chest pain, shortness of breath, fever, again coughing up blood, and night sweats. Immune suppression from chemotherapy can also result in viral diseases such as cytomegalovirus. That's a herpes-like virus. And that leads to hepatitis, Guillain-Barré syndrome, which is a severe paralysis that can be fatal, encephalitis, myocarditis, that's inflammation of the heart, low platelets, those are the blood clotting cells, infection in the stomach, in the intestines, in the esophagus, and even the retina of the eye. Another viral disease, herpes, causes ulcers on the palate in your mouth, the gums, the tongue, the lip, or the facial area, and leads to bleeding, severe pain, and inability to eat or drink. Herpes infection in the esophagus leads to the inability to swallow and pain behind the sternum and weight loss. Another possible side effect of the chemotherapy is herpes zoster, which is shingles. This causes a deep searing, knife-like or burning pain and rash over almost any area of the body. Another disease that chemotherapy causes is pneumocystis pneumonia. That's an opportunistic infection that AIDS patients get. And toxoplasmosis, another fungal infection. It has severe central nervous system involvement in at least half of the cases of this disease in immunocompromised patients. It causes brain dysfunction with or without seizures and meningitis. Chemotherapy also causes constipation, diarrhea, skin necrosis, that means areas of your skin can die, and peripheral neuropathy, that's the loss of reflexes, and nerve numbness or pain and muscle wasting. A patient is usually told he or she will have to wait a month between treatments because the chemotherapy, which is your treatment, is so destructive to your body and the blood-forming cells in your bone marrow that you have to wait for the bone marrow to recuperate and begin making new cells again so you can have another destructive treatment to suppress your bone marrow and your immune system even more. To increase your red blood cell count so you won't be anemic, a drug like erythropoietin is given. But erythropoietin, which has brand names like Epigen or Epoetin, these drugs are used to treat the side effects of the chemotherapy, but they have lots of side effects as well. They cause headaches, fatigue, dizziness, seizures, threatening blood clots. Over time, chemotherapy causes damage to the heart, the lungs, the kidneys, with kidney failure, the immune system, and the blood-forming marrow, resulting in overwhelming bacterial infections. It also causes toxicity to nerves, resulting in the peripheral neuropathy that we spoke about. That's numbness and strange feelings, including pain in the feet and legs. Chemotherapy also causes serious endocrine problems, such as thyroid and other hormonal problems. It causes premature menopause and infertility. Plus, it causes secondary cancers, a second kind of cancer in addition to the one you already have. All these side effects are handled by the doctor prescribing more drugs with more side effects. Drugs such as steroids are given to decrease these side effects, but steroids like prednisone have more side effects, including diabetes, weight gain, osteoporosis, yeast infections, depression, sleeplessness, dementia, and psychosis, and increased susceptibility to infection and more suppression of the immune system. Just how devastating the side effects of chemotherapy can be is revealed in an illustration told by Dr. John Laszlo, who was Senior Vice President for Research at the American Cancer Society. Dr. Laszlo is considered an expert on the complications of cancer care. This is a quote from him. "Not only do many patients suffer from extreme nausea and vomiting," he writes, "but about 1/4 of the long-term patients become so conditioned to experience these symptoms, even in the absence of the actual drugs, that we have seen patients drive into the hospital parking lot and promptly begin to vomit, or vomit when they smell the alcohol sponge used to clean off the arm prior to the IV being replaced for the chemotherapy, or even vomit when they see the nurse who administers the chemotherapy, even if that person is encountered out of uniform in a supermarket or elsewhere away from the hospital." Chemotherapy is a systemic poison. It poisons your whole body. It appears to succeed for that very reason, at least temporarily. The tumor shrinks. But the chemotherapy fails for the very same reason. It's a systemic poison. In other words, it will shrink the tumor, and your tumor marker blood tests may go down for a while. It appears to be working. But it will also severely damage your immune system, so you will be in a seriously weakened condition when the cancer returns, which it always does. If you have enough immune system left to fight it, you may survive. But if you don't, the cancer takes over. John Cairns, a professor of microbiology in the School of Public Health at Harvard University, wrote in an article in the journal Scientific America that, quote, many of the drugs used to treat cancer are known to be carcinogenic, cancer-causing. And one of the long-term effects of chemotherapy is that somewhere between 5 and 10% of the surviving patients die of leukemia in the first 10 years after treatment. The chemotherapy, the treatment, causes the leukemia. He continues, if cancer specialists were to admit publicly that chemotherapy is of limited usefulness and is often dangerous, the public might demand a radical change toward non-toxic methods and toward cancer prevention. To ward off these criticisms and demands, the use of chemotherapy is even advocated by those members of the medical establishment who realize how ineffective and dangerous it can be. Now